So I want to just kind of walk through game plan, what we're thinking, what we've got. Nicole, if you could walk through a little bit of what you got yesterday.
On Thursday, I got up there and spoke with Prevention Point. This has been a neighborhood that's dealt with a drug problem for the past 30 years. That when OxyContin hit the streets, it forced a lot of the drug dealers to tinker with their, I don't know if you want to call it like a recipe for heroin, Oxy being so pure.
You know, fentanyl, this drug that was a relative non-player in the opioid epidemic just 2 or 3 years ago, is now in many places the leading driver of deaths. What is fentanyl? What is law enforcement doing to try to deal with fentanyl, right?
Are you talking to Philly PD?
Yes, but I'm gonna probably ride along with the DEA.
Will they let you film that?
I'm pretty sure. For the last few months, my colleagues and I have been reporting on the opioid epidemic, specifically on fentanyl, a man-made pain relief drug that has caused a huge spike in overdose deaths across the country. Right now, we're on the Amtrak up to Philadelphia because I wanted to examine the opioid crisis in major cities and counties that surround them. So much of the media coverage and conversation has made the opioid epidemic sound like something that's only happening in rural white America. But cities like Philadelphia are seeing hundreds of people dying, and it's only getting worse. So the area where a lot of people are using their drugs are here, what they call the tracks. It's the little areas underneath the train tracks that run through the neighborhoods here. In the tracks, there are about 100 people who live, thousands of people who use, and then hundreds of thousands of discarded used needles. Some of the folks who come down here to use, they collect the discarded needles and turn them back in for clean ones. Some of the folks we've interviewed, actually, they sell clean needles, one for $1, and they use that to subsidize their own addictions. So we're outside Prevention Point, a neighborhood organization that's been around for 25 years that focuses on harm reduction, needle exchanges, medical care, and helping folks who are using get into recovery.
I have 2 doses of Narcan, and unfortunately I had to keep multiples because, I mean, a couple of Wednesdays ago, I ended up coming across 4 people overdosing at the same time. We informed the individual, we gave you Narcan, it's going to be in your system for 30 to 90 minutes. Do not use any more within the next 2 hours because what you used and caused the overdose is still in your system.
And then
when the Narcan wears off, if you put more in your system, that's going to end up killing you. Injection drug users were getting infected with HIV and hepatitis at a rate of 50%. Since then to now, HIV transmission among that population is down to 5%. Hepatitis B is down 80%. We have probably saved the city, I would easily say, $100 million. You know, we can stop. But at the end of the day, the cost is going to fall on the taxpayers because they're going to have to fork the bill to treat
Of course,
these people.
that if we don't deal with this public health crisis up front, the public still is going to be footing the bill for it on the back end.
Yeah. So you have in 2010, where they're introducing fentanyl into the heroin and selling the mix. By 2015, they reversed it, and they were putting heroin into the fentanyl. Last year, they were just selling straight out fentanyl. Right now, what you find on the street is mostly fentanyl.
How did you start using? When did you start using?
I started using 1977, 1976.
Yeah, so you started a 14, 15 shooting.
Yeah.
This is heroin?
Yeah, heroin, yeah. Mm-hmm.
You were living in the tracks?
Yeah, living in the tracks by the time.
And what was that like?
It was a learning experience, you know. I said, God, if I get me out of here, I'm gonna do my part, help people to say, yeah, I always pray for this place, you know, my Prevention Point, because, yeah, they gave me the hand.
Of course. So we're here with Special Agent Pat Trainer, the DEA, getting ready to tour around Philadelphia, going to some of the areas that have been hit hardest by opioids and specifically fentanyl.
You will see a lot of the same people that are down here up buying drugs in the area of Kensington. See, right after we cross that train trestle, it's going to change real quick.
Traditionally, who's lived up there?
Well, traditionally, these neighborhoods were very working class Philadelphia neighborhoods, and unfortunately, this neighborhood is has really struggled with issues around the drug trade and associated violence for several decades now, and probably no area has been harder hit in Pennsylvania than this neighborhood. Philadelphia County had 907 fatal overdose deaths in 2016. Which is more than any other part of the States. It's not going to be real hard for you to figure out who's doing what up here. You'll see to the left, this is a pretty notorious block, Waterloo Street here. These are some active areas where a lot of drug trafficking is obviously occurring and stuff. So there's another one over there.
Everyone here agrees that fentanyl has upended the drug market in Kensington. The police, the users, the residents, they all say they've never seen anything like it before. Now, soon enough, the tracks that run beneath this neighborhood are going to be cleaned out. Many of the residents around here and the users themselves say they're not really confident that cleaning out the tracks is going to fix anything. They think that those users are just going to be displaced. They're going to start using on the sidewalks instead of under the trains. Philadelphia and Pennsylvania as a whole certainly hasn't figured out how to stop the opioid crisis and how to save the lives that are being lost. But they're going to try something. And right now, that something is cleaning out the tracks.
People don't realize this has been here for years. There was over 100 people down there. You displaced 100 people easily, and they don't have anywhere to go. And now they're regretting because they thought the cleaning out meant the people were going to disappear. They're people. Somebody said to a friend of mine, "Oh, we don't call them homeless anymore. They're our outside neighbors." And she goes, "Okay, then maybe you should treat them like neighbors then."